Hello, my name's Dr. Paul Andell. I've been asked to present for you some ideas around gangs, county lines, and perhaps new ideas on the current trends in Class A drugs and the middle market. I currently work at the University of Suffolk, where I'm a senior lecturer and have been carrying out recent research into these areas. I'll start by saying that I'm from a practice background and used to work in gang exit projects. I've also had significant community development experience around minimising the harms from drug markets. I guess policy-wise, the story goes back maybe 2008, 2009 for us, where we conducted research in 4 northern cities, and our findings were quite astounding in terms of the involvement of young and vulnerable people within the drugs crime nexus, if you like, or alternative markets in illicit drugs. What we were finding in 2009 was that young people were coerced into delivering drugs. Young people were coerced into their involvement into sexual activities. Young women were, for example, involved in group sexual activities with what at that time was a blurred definition of gangs, and the whole UK gangs thesis debate between Simon Holsworth and Professor John Pitts was at its peak, and the impact that this debate was having was that when findings such as ours were coming to the fore, the policy pendulum at that particular time was that gangs didn't really exist. These were street collectives, and the unintended consequences of well-meaning professionals who were avoiding labelling at that time perhaps served to ignore harmful behaviours which perhaps could have been addressed earlier, in my view. However, we move from an era in policy of gang denial, for whatever the good intentions that was, to an era of perhaps where I think we are at the moment with gang blame, where everything seems to be the issue of gangs, and perhaps that policy pendulum has swung too far in the opposite direction. So, without getting into the theoretical, philosophical debates about the nature of reality and what is a gang, I'd like to talk a little bit about our recent findings in a county town around changes in the middle market. Having undertaken gang research in northern cities and presenting findings of harmful, exploitative behaviours from groups of people who we now recognise as gangs, that's networks with hierarchical tendencies, we then started to focus our attentions in London boroughs, in South London, and at that time we found that some of our young people were going missing from the projects. They'd turn up in different counties after several days or several weeks in some cases away, and we would make inquiries as to where they've been, why they've gone missing, and the responses was, well, I've gone country, which we were struggling at that time to understand what exactly was going on. However, with our kind of later research, it becomes apparent that young people from one part of the country usually are coerced into carrying drugs to other parts of the country. They may stay there for a few weeks. They may live in very unhealthy environments, maybe in a flat which is being cuckooed or taken over from a vulnerable tenant, maybe a substance misuser, so on, and their premises is used to store and sell drugs sometimes, or used as a basis for running drugs in the alternative economy, which has become what is known as county lines. County lines, as you may know, is the idea whereby a telephone line is held by a metropolitan gang. Interestingly enough, these metropolitan gangs were the street gangs of yesteryear, which have left the street and moved into the more discernible, semi-organised realms of the middle market drug distribution, certainly in Class A drugs anyway. And when we talk about Class A drugs, we're talking about crack and heroin in the main. So the telephone line is held in the metropolis. A drug user can ring up on this line. A separate line is used then to contact a runner who may be a young person from the metropolis or might be a local young person who then delivers the drugs. Well, okay, what's new? Yes, there's always been distribution networks between smaller towns and cities in the metropolis. What's the difference? Well, local empirical studies suggest that rather than local crime families being responsible for drug distribution in the smaller towns and cities, there is a kind of franchising that goes on from the larger metropolitan areas who bring their product, which is usually stronger, which is always a sign of a healthy supply, to the locale by using a system of little and often, whereby Class A drugs are transported by young people who are sometimes manipulated and coerced into carrying drugs, sometimes in their luggage, other times strapped about their person or inserted into bodily cavities. And I guess the maxim is little and often, but over time, maybe smaller amounts have a cumulative effect whereby large amounts of Class A drugs are moved. Well, what's the point? Well, the point is that our services to address the different levels of drug markets, divided sometimes by the weight of drugs. So if there are smaller amounts, then the response would be left to local services. If there are larger amounts, they'd go to more specialist teams with more sophisticated ideas of information gathering and detection. So by keeping a low profile, by utilising what's known as clean skins, that's nobody with records, criminal records, not noticeable young people who are easy to manipulate or vulnerable adults, then the people who are operating are less likely to be detected and the supply increases. I guess the question with a stronger product, I think the question is, are we sleepwalking, as it were, into a supply-led increase of prevalence for Class A drugs? In our recent research, we had difficulties disaggregating data to find out exactly what the prevalence rates, how they had changed in a local area. What we did observe was proxy measures of used works needles, for example, in parks, and those counts indicated that there was a significant increase, in fact a doubling of the needle finds over a 3-year period. Not an exact science. This was kind of triangulated with announcements from the ACPO lead in substance misuse, who suggested that regionally over 1 year there was an increase in Class A prevalence of 15%, which kind of makes us think about the community safety and public health aspects of new markets and the increase in Class A drugs of a higher purity. Well, the mechanisms for drug distribution, as I've mentioned, involve coercion of young and vulnerable people. They involve the cuckooing of takeover of vulnerable residents' flats to use as a base. It involves the more hierarchical notions of gangs who coerce and co-opt local crime families who may have been involved in past supply to only buy from a particular product. The advantages of that may be the quality of the product, how the product's marketed, phones with lists of users' names, exchange hands for many thousands of pounds. Marketing texts can be sent, particularly on benefits days, offering special deals, 3 for 2, marketing the product as the best in the business, and so forth. And of course the market relations, or the public relations in the alternative market is violence, because if people are not paid for their product, then of course the small claims courts is out of bounds. So how do these things become resolved? They become resolved with violence, and the nature of the violence leads us as criminologists to start to classify how groups may be organised or disorganised, how crime may be discerned in terms of local organised crime. For example, an example of a case study would be that sometimes young people who are coerced into working for particular county lines, and there will be several tens of county lines in particular rural county towns. If the young people are robbed, for example, by more entrenched older drug users, then the violence in response from the metropolitan drug dealers can in effect be lethal, and has been lethal on occasion. So this kind of instrumental violence to maintain a respect, a reputation, the cultural capital of violence within the business, and the ability to organise lethal violence leads us to conclude that the gangs of yesteryear, the street gangs of yesteryear, are metamorphosing, certainly in the Class A drugs market, in crack and heroin, towards a more semi-organised, local organised crime model. And several other academics have undertaken field work, and their empirical research seems to match these findings. I guess we've got to ask ourselves, why here, why now? And for this, we need to understand both the push and the pull factors that are involved, of course, in terms of structural unemployment and social exclusion is kind of an area of strain which drives in many respects crime. But it's not just a social exclusion, there's also something a bit more meaningful, which is a over-cultural inclusion. So on the one hand there's an economic exclusion, on the other hand there's a cultural over-inclusion where people want to enjoy the glittering prizes of consumer society, and which would lead to, yes, a functional explanation of their involvement in the alternative economy, but also the emotions, the structured emotions of being somebody, and to be seen to be a member of a gang brings with it a cultural capital. In some respects, one respondent said, well, you don't have to be hard or violent to be part of this, you just need to know someone who is. So they carry that kind of cultural capital of, as Jack Katz says, the badass, which could be immensely attractive to young men who are denied respect and reward within the legitimate world. Of course, our responses, we can't just look at the actions of these particular issues, we've also got to look at the reactions to these issues, and we can't ignore the fact that our preventative services such as youth and community work have suffered significantly from the economic policies of austerity. I think there's something like 270 youth centres that have closed since 2012. There's a ridiculous 25% of cuts to our frontline policing services. The preventative work with early Sure Start is now under significant threat through the reduction of funding. So in effect it's a perfect storm, as it were. What are we going to do about this scenario of young people being lost to semi-structured drug dealing networks of gangs in county lines? Well, there's something about social proofing of our most vulnerable who are coerced, social proofing meaning that we support people who with drink or alcohol, substance misuse problems in tenancies by providing appropriate outreach services, people with mental health difficulties by again providing the appropriate services so they are not vulnerable and left on their own to be preyed upon, and social proofing in terms of housing young people who may be leaving the secure estates, who may have struck up relationships in youth offending institutes, for example, or secure children's homes, whereby they will be offered protection from youngsters who are more involved in metropolitan life of supply and demand in the alternative economy, and in return for those favours whilst in the institution there's an expectation of establishing new networks outside of the institution. So alongside preventative work such as social proofing, we need to work more collaboratively around young people who may be on the fringes of this type of phenomenon. We need to work a little bit more creatively in terms of how we might dissuade, discourage or exit young people from gang culture and gang life. How do we do that? Well, we set up services in communities. We restore some of those youth and community services, which was always our antenna and our kind of protective layer of a sensible adult to test out ideas and conversations with, in terms of beginning a social pedagogic process, a relationship, a teaching and learning relationship, if you like, an empowerment relationship with an appropriate adult in the community, rather than abstracting young people into services for designated programs of thematic education. We start from where young people are bringing their concerns. We use peer education. Young people who may already have successfully exited gang life can then act as peer mentors to support young people who are on the edges. Of course, for the more entrenched gang members who may be a little bit more difficult to dissuade, then there is the ideas of call-ins can be used, but only, I guess, with the cooperation of several services in partnership. So on the one hand, you are offering an alternative lifestyle. On the other hand, you are saying, well, the behaviour is unacceptable, and if it continues, you send out a signal whereby those young people will be pursued vigorously by the enforcement agencies. Further up the network, if you like, for those people who are cynically manipulating young people, then of course the full force of our criminal justice system should be availed to them. And in fact, if we look to other models in other cities in this country, such as Manchester, if you take the head of the network away and you start to exit those who are already involved and prevent at the same time, then you start to reduce the harm. This, of course, cannot be possible without working in neighbourhoods with communities. And this kind of live feedback of community development approaches is essential to reducing harm from county lines and urban street gangs / semi-organised local crime networks. A live feedback loop from the community can provide better information flows to services, but I say information flows because information is a two-way street and shouldn't just go one way. So, for example, the unintended consequences of an enforcement operation in some parts may make matters worse. If they take out a lower level of dealers, then perhaps sometimes this can create a vacuum where higher risk takers move in, and the palpable effects can be felt in gang affected neighbourhoods, and this would take communities to step up and forward to suggest to service providers that those kinds of interventions may be making matters worse in terms of unintended consequences. So in terms of a broad strategic approach, it is something about enforcement at the correct level, which may be beyond the local and into the regional and national. It is about prevention work at the lower levels, it is about gang exit work in the middle levels, and it is around a context of community development, because these kinds of issues are dynamic and we need dynamic, flexible and reflexive interventions to reduce harms in communities.